Hello and welcome back to part 10 of this series of videos on staying healthy and preventing COVID-19 infection during this current pandemic. So we already mentioned the importance of some of those nutrients to control our immune system. In addition to the balanced diet, that's why we're talking about macronutrients, especially vitamin D is essential to boost our immune system. In addition to vitamin D, a combination of other nutrients such as vitamin K2, vitamin A, magnesium, zinc, and selenium are also likely to be benefit in boosting our immune system. Having a weaker defense system would allow COVID-19 to enter and attack our lung cells easily and also expedite their propagation. Vitamin D deficiency is one of the most common or most important risk factor that increase the vulnerability for virally mediated respiratory diseases, including all coronaviruses. Moreover, vitamin D deficiency markedly impair our overall immunity, thus increases the bacterial, tuberculosis, and even the fungal infection. It is estimated that its adequacy, in other words, having serum 25-hydroxy vitamin D level more than 40 nanograms per ml, which is equivalent to 100 nanomoles per liter, will reduce the risks of respiratory viral diseases by more than 30%. That includes the coronavirus diseases of the respiratory system. The current data suggests that the rate of infection and the mortality rate from COVID-19 is inversely related to the population serum 25-hydroxy concentration. It's important to note that here we are talking about not only individual but also the community population vitamin D level, so that you are reducing the risks of community outbreaks from coronaviruses. Rates are highest among those with serum 25-hydroxy concentration are less than 12 nanograms per ml, which is 25 picomoles per liter, which we consider as a severe vitamin D deficiency. Now, in children, this will lead to rickets. In adults, it causes osteomalacia, the weakness of the softening of the bone, and proximal myopathy. So the people may not be able to get up from the chairs or beds and feel weaker and lethargy throughout the day. So these people are very high vulnerability to catch this infection. In addition, sufficient active vitamin D, which is calcitriol, also regulate the renin-angiotensin hormone system. So this is important, specifically reduction of that, controlling of that will reduce the entry of COVID-19 into the bloodstream through the ACE2 receptors located in lungs or pneumocytes and also in all mucous membranes. So let's have a brief look at the importance of calming the mind and indeed meditation or Tai Chi or yoga to overcome the disease. So stress, we know that weakens the immune system overall. So the opposite of that is actually calming the mind and the body. Relaxation is aid to enhance the immune system. So this will work in conjunction with the adequate vitamin D intake or staying in the sunshine for 30 minutes each morning to boost your vitamin D levels. The current pandemic affects everyone. No one is safeguard from that. The ongoing stressful situation, especially for the frontline workers during this pandemic, not only affect them but also affect their families. They can bring infection, their stress can affect the families, and also live in higher risk areas or high risk communities. They all undergo stress related issues and somewhat reduction of the immune capacity. So as in the case with the post-traumatic disorder, PTSD situations, the sustained stress can lead to hormonal mediated longer term deleterious medical and psychological consequences of our frontline workers who protect us. So we need to help them to reduce their risk by providing them with the adequate protection, food, nutrition, and indeed the rest they need in between their work shift. Not only the mind and body, but also the long-lasting negative changes occur in the structural changes occur in the brain, what you call the negative plasticity of the brain when they confronted with a prolonged stressful situation, as shown clearly in those who are suffering from post-traumatic stress syndrome. One also must realize mentally and physically adapting and coping with the changing situation. In other words, develop resilience is essential to overcome stressful conditions or situation. This influences the long-term outcome not only for individual but also the families and entire communities. One of the effective ways is to boost resilience to engage in daily meditation. Irrespective of a religious belief, meditation of any kind will help to boost your immunity. So consider practicing some kind of meditation for a few minutes on a regular basis, especially during these hard times. This will allow you to manage your stress better, able to relax your mind and the body, and get rid of the tension otherwise would get accumulated and cause issues including the controlling or negatively controlling your immune system. So in next video, the part 11, I'm going to discuss the mechanisms how vitamin D protect people from COVID-19. Till then, take care and be safe. This is Professor Sunil Wimalawansa from New Jersey, United States of America. Thank you.